video is for my fellow post-op massage therapists. I want to share what's different in 2024 about getting post-operative clients than it was in 2016, and the two things that I'm doing to make myself at the top of mind, at the top of that list for the client that's looking for help after their plastic surgery with post-operative massage. So the first thing I want to talk about is 2024 versus 2016. So in 2024, it seems like everybody and their sister is up on social media talking about, I know Lymphatic, I can help you after your surgery, come and book an appointment with me. It was not that way in 2016. It seemed like in 2016, in 2018, you could just take that MLD class, you can put it up on your website. I know MLD, I know lymphatic massage, I can help you after your plastic surgery, and sit back and wait for those phone calls to come in and fill up your schedule with those clients, because you were the only one in town, weren't you, in 2016? But now in 2024, everybody seems to know how to do it. Everybody seems to want to help clients after surgery. So what are the two things that I'm doing to make sure that I am top of mind for those clients? Because let me tell you, the plastic surgeons that refer clients to me, it's a list of therapists that they are giving to the client, and I am one of those therapists, and so I have to be top of mind so that client decides to get their massages with me versus other people in my town. So what are the two things that I'm doing? Number one, I am being more consistent with posting on social media. I love to hear how a client said, oh, Kathleen, I've been following you for 6 months. I've been following you for a year. So when the plastic surgeon that I went to for liposuction gave me a list of those therapists, I already knew your name. That is the number one reason I recommend that you post and post consistently on social media. Pick one, pick two, pick 3 different types of social media and get your message out consistently. The other thing I'm doing is doing a deep dive. I am making sure I am an experienced therapist and I know the questions and answers that client is going to ask, because I want them to come back to their plastic surgeon, not only saying, hey, I feel better after I went to the massage with Kathleen, but Kathleen knows her stuff. And I think that's another two. There are 2 parts that you have to hit. You have to hit both those parts. The client has to feel like the therapy worked, and the client has to feel like you knew your stuff and you knew what they were going through and you had answers to their questions and you were able to help them along their journey. So what did I do to get this deep dive to know more information? First of all, I went back to ASPS website and I looked at their statistics. There's statistics out from 2022 and they're talking about the top 5 procedures that the ASPS plastic surgeons here in the United States of America performed. And do I know everything I need to know to help clients after those top 5 procedures? So let me share the top 5 procedures with you. Number 1 is going to be liposuction. And we know you and everyone else in town seems to be able to help people after liposuction. 325,000 procedures last year by ASPS surgeons were liposuction. So we definitely need to know our stuff to help people after liposuction. But are you a one-trick pony? Is liposuction and, liposuction BBL, liposuction, other fat transfer, the only thing you can help people with? Or are you like a quadruple, quintuple threat out there? So what's the number 2? Surprisingly or not surprisingly, breast implants. 298,000 people had breast implant operations by ASPS plastic surgeons in the 2022 statistics report. And what's after breast implants? Tummy tuck. 161,000 people had a tummy tuck. And then another breast surgery in the top 5. If you do not help people after breast surgery, you need to figure out how you can add this to your practice. 143,000 breast lifts performed by ASPS plastic surgeons in the time allotted for this statistics report. And number 5 is blepharoplasty. And that's at over 115,000 patients. So that's the eyelid lift. And I'd like to focus on another surgery that is more likely the people to come to us is a facelift. So people might have a facelift as well as this other upper bleph, and that is 72,000. 72,000 facelifts were performed just by ASPS plastic surgeons in this statistical time period in the United States of America. I need you to, if you really, really want to be at the top of your game in the city you live in, focus on the knowledge and increasing the knowledge for these top 5 procedures. Know your stuff about liposuction. Know how to help people about liposuction, but that's not all. Know how to help people with breast implants, with breast explant surgery. Know how to help people after their tummy tuck. Know how to help people after their breast lift surgery. Know about that procedure. Know how to help people recover for it. And then that face surgery, the upper bleph surgery, and I would suggest also the facelift, since there's so many facelifts out there, and facelifts are increasing as we're all in Zoom, we're all seeing ourselves on video. And I myself have had a facelift, and I found that I am such a better help to clients because I know about the facelift experience, and I can tell them my own personal experience. And I also have done research on how people, how the surgeons are doing the facelift, where the manual lymphatic drainage changes during the facelift in the immediate post-operative period, and all the different things around the facelift that make me someone that can not only deliver the MLD that we need to give to people after the facelift, but also go back to that surgeon with a glowing review. That is what is going to have that door open, that constant stream of referrals, that nurse, other employees in the practice go, oh yeah, you definitely have to go to this particular massage therapist, because not only do the clients feel better, but in the glowing reviews that they give when they come back to their post-operative appointment, they will say, you know what, the therapist knew her stuff. And if I had one, I have a dozen clients that have told me that they went back to their surgeon and said, this is so amazing, you need to recommend post-operative massage to each and every one of your clients. This really made my experience of healing after plastic surgery better.